Hi guys, it's Shanna Montana here, and I did want to give you guys a content and trigger warning over the next 3 episodes of the podcast. We will be speaking about Black maternal health in America, and we know that for some people, that can be a traumatic event, a stressful event, and just an event that you are not comfortable hearing or talking about. So I wanted to just let you guys know ahead of time that for the next 3 episodes, this will be the material that we are diving into. So if you can get something from it, great, but if you are not able to listen to it, just skip these next 3 episodes and we'll catch you after that. So, without further ado, we now head into our intro of the To Be Single or Not to Be podcast.
You are listening to the podcast To Be Single or Not to Be by Shanna Montana, a podcast where we talk about the single life, dating, and relationships so you can make a decision at the end of each episode and decide to be single or not to be. That is the final question.
That's a whole mouthful, and that takes me right to that. So pre-existing conditions, do you all recommend, and do we do this in the community enough, say for people that can maybe afford it or have the access, where we get those certain tests and things like that before we get pregnant to see what the risk may be? Do we do that often enough, you guys think?
Well, one of those tests is the test for sickle cell traits.
Well, any of the tests. I'm just talking like in general. We don't, we have to dive into each one, but just do you all think overall we get tested enough that we look for those things? We don't.
Not until we feel like it may be us.
Why not? Why don't we?
Because it's not a problem until it's a problem.
That part.
Yeah.
I'm just so like
it's not a problem. If it ain't broke, we're not fixing it. If it is not bothering me, we're not bothering it.
And so we don't even think like, I'm 35 plus. I don't know why I want to say my age. I'm 37 and say I want to have a child. Like people wouldn't think like, I think I need to go get everything tested because these parts are older.
Well, I mean, that's just like, and I'm gonna throw this disclaimer out here right now. If you're listening to this podcast and haven't scheduled your yearly, I'm gonna need you to go do that.
Yeah.
Right.
It is just February.
And people don't. Healthcare is one of those things, once again, time, making it more convenient. And then also for a lot of people, there's a whole mental aspect to this. Like, what stress does it bring on for me to even put myself in a mindset to have these tests and be like, I'm going to be okay no matter what comes back. If these tests come back saying that, come to find out, I got a huge family line of so many things that my family didn't know how to put into words. And now I'm telling my partner, hey, when we have a baby, here's the things that I alone bring to the table.
But I think it may be a scary thing, but it's necessary. I think more people should do it.
Oh, I agree with you. I'm speaking for the people like, baby wise,
But like she said, if it's not broke, don't fix it. If I think everybody else been having babies, they all right. I should be okay. You tend to have that mentality, but no, go ahead.
Also, the healthcare system in the U.S. is set up not for prevention, but for treatment, not to cure, but to treat. They want to continue to treat and not prevent any of these illnesses prior to happening. So no, they don't want to know beforehand.
And they don't want us to know beforehand.
They don't want us to know beforehand. And we don't know that we can know beforehand.
That's wild to me, but it's not wild. It's wild in the context, like, I guess, hearing it said out loud, because I know that people don't know, they aren't educated, don't have resources, all the things that we're saying. And I just want us to do better with that. So that leads me to give this last fact that I found. It said the estimated national maternal mortality rate in the United States is about 17 per 100,000 live births, but is about 43 per 1,000 live births for Black women. Furthermore, data from the CDC pregnancy surveillance study that shows these higher rates of Black maternal mortality are due to higher fatality rates, not a higher number of cases. This indicates that the higher maternal mortality rates among Black women is not due to a larger number of high-risk cases, but because Black women are more likely to die during or giving birth at a disproportionate rate. So, along with, we talked about the socioeconomic status, the access to healthcare, pre-existing conditions. The next thing that comes to mind when it comes to medical racism, what does that look like? That was a new term for me. Somebody tell it, listen, what is medical racism? Like having you walk in, it's a white doctor that has a problem with this Black woman. or what?
That and what I was saying when I was talking about this research that says that we, don't feel same pain the same way. So we don't need medication.
Ah, okay.
Also biases. So bias plays into that. And a lot of people don't recognize or will like choose not to recognize their bias because and it's something Aeryka and Callie touched on when it comes to like coming into a hospital and being asked, is this your first baby? As if to say, like, are you gauging, are you going to be able to manipulate me in the room based off of what I know?
Hold on, and let me interrupt that. It was a thought somebody had on an Instagram post. I was deep in the comments, and people were talking about just different pain experiences they've had with dealing with giving birth, and literally, medical procedures. And one lady said that she was having some medical procedure done, and she was telling the doctor it hurt, and the doctor literally said to her, "You've had 2 kids, you'll be all right," and kept going. And I'm like, so that it's like what Aeryka said earlier. You asked me if I had a kid before, so I know, well, she can deal with this. She's done it before. She knows what's going on. And that's something that my best friend experienced. She was her first child, and she had 2 nurses, and she said she could tell one nurse had that you thing, that character, that empathy, very understanding, walking her through everything, as if she didn't know anything, even though she's a medical professional. So she was like, some things she knew, but she still wanted somebody. She's like, I'm a nurse, but I've never had a child. So she said she appreciated, it was one nurse that was very thorough with her. And then it was another nurse that like, she would only tell her something if she asked. So you over here, maybe you changing fluid, doing whatever in the room. And she's like, I'm looking at her. I know what she's doing because I'm a medical professional, but why aren't you telling me what you're doing and why you're doing it? Like literally would have to ask her. And that's crazy to me.
And even on that medical racism piece of we're advocating for our brothers and sisters to have doulas and how the healthcare system sometimes responds to that because they know you're walking in with an advocate.
So they feel like,
that or that they gotta now be prepared. Like this ain't army against army. I'm not trying to go to war with you. I'm literally here to advocate for them to make sure they're getting the service that they need. It does not mean you need to put on an armor like I'm about to attack you, but I do need you to know that you're not going to treat them any kind of way.
Right. What has been your all's experience with that, Aeryka and Callie? Have you all encountered things like that where doctors kind of maybe are combative or feel away because you're there?
Yes. So I walk in a world where at any given moment, both my worlds are anti each other.
Mm-hmm.
So, as a doula, though I was a doula before I graduated medical school, it was like, oh, you're a traitor. You're going into a different space and you're teaching people to fight against us. It's like, no, I'm not. I'm doing the work that you should be doing as a physician, explaining what you're doing. Mm-hmm. You weren't born knowing these medical terms.
Right.
So why not speak to somebody, in terms that they can understand, use words that they can understand. Instead of saying, using all these big words, just say, hey, listen, this and this and this is what's going on. This is what's happening.
Yeah.
And then on the physician side, it's like having to talk to, the attending physician, like, okay, so this patient has a doula and, this and this and this is about to happen. And they said, X, Y, and Z. And it's like, why do we need doulas here?
Oh, wow.
And then there's other doulas who's like, well, medical professionals I train. I'm trying to understand what class you sat next to me in med school, because you can't speak to my training. And also my approach is different as well because I didn't go to MD school. I went to DO school. Okay. So my approach to medicine in general is different as opposed to, you walk into an office and you say, hey, doc, my chest is hurting. They're only evaluating here. Mm-hmm. So let's talk about your diet. Let's talk about your exercise. Let's talk about your mental health before we go straight to medication and straight to surgery, unless absolutely necessary. So change your diet, exercise a little bit more, meditate some, maybe go into therapy, come back and see me in 8 weeks.
Right. Definitely alternative options versus exactly. Do you want this depression medication? Because they stay trying to hand that out.
Exactly. So, I mean, even still, it's just like I said, I walk in a world where, both my worlds are anti each other most of the time.
And that's wild that you are on like both sides of the table.
Yeah. It's a tightrope. I'm literally walking this super thin line, and it's disheartening. And sometimes I don't have a place to, unload because I'm walking into this room and I'm just like, do you want this? Do you need this? you know you can say no. You know you can go against this protocol for this drug.
Yeah.
It's not the end of the world. But I literally had a physician tell me, you need to turn doula off. That's not what you're here for.
Oh wow.
So
I appreciate you
Not
for
I
showing
need
up in both spaces though, because it
yes.
shows that you really do care about us and you're here for us. And I think it it's reminding me of even being in my public health program and when we read Medical Apartheid and just turning that narrative around. We are taught so many times white people, especially black men, don't like the doctor. And then we find out the history of what these medical programs and institutions have done to black people. And it's like, oh,
That's
okay.
why.
That's why you know what? Let me back up a little. I'm over here in this program talking about I'm teaching, I want to be, help people be better at bedside manner and teach the community that the healthcare system isn't against them, not even realizing I was lying to myself.
Mm.
Like, dang, I'm trying to go into a field that really has done harm to my people. So I had to unlearn myself, learn again, and then realize, how do I become a better advocate? Like, how do I toy that line? And part of that is making sure that when I'm talking, I understand even for myself the hurt and pain that has been caused and that I will have to answer for because I am someone trying to create change. Not saying that I'm answering in terms of I'm responsible for it, but
Mhm.
I'm answering for it because I'm the person that's actually going to speak to you and actually maybe give closure or acknowledge that that hurt was ever made.
Absolutely. I'm gonna stand in the gap. So Callie, what would you say your experience has been with that? Being a doula, have you been in, any situations kind of like what Aeryka and Chemyeeka talked about, the where it wasn't received well that you were a doula that was there?
Not necessarily as a doula. I'm really just getting started on my journey, as a doula, but definitely as a nurse, I've had that. I've experienced medical racism. I would say one time I worked in the cardiac ICU. It was a pediatric. So this is on the subject of the Black infant health crisis, which is, right up there with the maternal crisis. I was working overnight. I was partnered with a white nurse, and it was a little girl, a baby girl, Black baby, brought down from the NICU to us because she had a cardiac condition that needed to, and she needed to be in the ICU with us. The white nurse was my partner, and she literally told me that in her experience, you can't kill a Black baby. And she ranked it. She kept going. So in previous hospitals that she worked for, her experience was that Black girls are the strongest, then it's the Black males, then Hispanics, and then whites. And my face looked like yours.
I'm over here like, what? Like, what was your like? Could you even respond to that?
It was 3, 4 in the morning, and I was a new nurse. She had been a nurse for forever at that point. I didn't really know how to respond. I was new in my nursing journey at that time. I didn't, you kind of get taken aback by stuff like that. That was my first experience with something like that. But I definitely took that experience with me for the rest of my career. And even now, it's something I think about all the time. And it's part of the reason why, I'm in this space for reasons like that. It's like, how do you know that? Were you trying? Like,
Tried to kill one?
Like, how do you know? How were you able to rank it?
Right. Like, yeah, like you got
yeah. And to bring a little context to what Callie was saying about the Black infant health crisis, and like how
I was definitely gonna ask, what's that
how
about?
we're talking about, Black women are dying at a higher rate, and disproportionate is the term I was looking for earlier, y'all. Dying at disproportionate rates. African American babies are not making it to their first birthday.
Why? What's happening?
Medical racism. You have
all the same stuff.
Basically, because
it goes hand in hand.
Take care of our children. So if we're going into an environment that we can't survive, how are our babies gonna survive?
And we're not gonna even discuss the medical kidnapping either.
You say stay
medical,
on topic,
no,
so
no, medical kidnapping. What's medical kidnapping? Okay, I know, I want to hear it.
We're ready for this, but
it's medical kidnapping.
So let me paint a picture for you. So baby's born, and there's this whole smorgasbord of things that happen after birth. Apgar scores, basically measuring the physical health and wellness of the baby. And then there's all these vitamin K shots and erythromycin. Well, erythromycin, people don't really blink an eye at you denying that or declining that. But that vitamin K, if you say no, look like you want to say no, look like you're thinking about saying no to this vitamin K shot, you're negligent. Calling a social worker.
I read about that. Somebody said they had to get their attorneys involved because they wanted to deny that shot. Why is that shot so controversial?
Preventing brain bleeds in your baby. In a nutshell.
Okay.
In a nutshell.
Is it something that? So why do people don't want to deny that one?
I think for some people it's more so just the idea of your newborn getting a shot. More so, and people are concerned, especially now surrounding vaccinations and needles in general. I don't want my baby to get the shot. I don't know what's in it. I don't, that whole thing. But even just denying it after birth, they side on you as a parent. So then social workers are getting involved and these babies are getting taken away. There's been national cases recently in the last 6 to 8 months. Of babies being taken away, even though parents in certain situations never even declined the shot. They were just waiting on a parent.
So to add to that, and I know not trying to go off topic, but
to
throw in the mental health portion of that. Like I'm sitting across the table from women and birthing people, and we're talking, and you talk about things that can contribute to death. And one of them is if you're afraid to speak. How am I going to go in and talk about harm, or I'm thinking I have postpartum depression or postpartum rage, postpartum aggression, when I think the first thing you're going to do for me as a Black woman is call DCS and they're going to take my baby. So I'm literally holding quote unquote things together or holding things in because I feel I do not have help because there's no way I can get the help I need without my baby being taken. So it's one of those do I get the help I need and risk my family being torn apart? Or do I remain silent and something tragic may be happening? Because you cannot do this alone. And I hope everyone hears me. You can't it's okay to ask for help and know that there are people out there who the first thing we're thinking about is not taking your baby. It's how do we make you better for your baby?
But that's real what you said about mental health. One, okay, the medical kidnapping, that is insane because now that you have put that terminology with it, I've definitely seen these cases on Instagram. It was a family I saw where there's something they refused in the hospital and they took the child and it had been months and they hadn't got their child back. So that is insane. And that's something that, because vaccines, there's been a lot of controversy. I feel like for a long time, people say, certain vaccines, they think they give kids autism, different things like that. And they just want to deny them. So it's wild that you, as a parent, you cannot advocate for yourself in that way in some instances. And then as you're stating with the mental health, if I have postpartum and I want to say something because internally I may be dying and I'm afraid to say something due to being afraid of the outcome, that is a dangerous game that is being played.
Because you're not seeing your checkup for your physician. So when they're going, you're afraid of seeing people literally. So you're not even getting your body checked up afterwards, which means things that a physician would see physically, they're not even able to see because you're literally not going in. And pediatricians, thankfully, are starting to, ask more questions of the parents when the parents bring the baby in for their checkups. But that hasn't always been the case. And even then, that doesn't mean the parent is going to tell the child's pediatrician that they're having these issues going on.
So is there any I guess foolproof way to go about doing that where you can know that if I am having these, thoughts, postpartum related, whatever they may look like a foolproof way to know I'm going to tell my doctor this and that they're going to advocate for me and I don't have to worry about, a social worker standing outside this door when I walk out.
Once again, doulas. And I mean, I'm not, for all the other doulas listening, I'm not trying to put the weight of the world on our shoulders, but it's we create relationships with our clients and hopefully our clients trust us. So, when I tell you hey, this is something we need to speak to someone about, also they know you do have the support. So it's not that question of, oh, well, is there someone helping you take care of look after the baby, or are you alone? Because that's a question people get asked a lot.
Yeah.
No, there's maybe a family involved, and even if there's not a family involved, and I am the family for those who may choose to be a single parent, I have a support system, and that lets them know too. Don't come at me sideways. Like I actually, there was a plan put in place, and we see, and that's a whole nother episode because we could talk a lot more about that. Um, but also to let everybody know who may be listening, and you're like, what just happened? This is all a part of that crisis we're talking about because all of this is birth, and we don't talk about that. Birthing is from the time you consider you want to have a baby, if for those who may are planning a family, or from the time you find out you are pregnant to after, and any individual who gives birth. And so I want to make that known that this is the hill Chemyeeka stands on, whether that be you had a miscarriage, you had a chemical pregnancy, you had an abortion, or you had a live baby. After your pregnancy is over, you're in postpartum and you deserve that postpartum care.
I
And
agree.
that's why, like, I explain to people all the time that people say, "Oh, I don't want to get postpartum. I don't want to get postpartum. It's not a cold. It's not, a sickness that you can get. It's literally defined as the period after having given birth. So it becomes less of a diagnosis and more of a symptom.
Okay.
So it's the word used to describe the type of anxiety and mood disorders that you have. But that's why that type of planning is important. It's less of everybody will prepare you for pregnancy and labor and birth, but nobody's preparing you for what some people call the fourth trimester. Nobody's preparing you for restless nights. That in theory they are, but they're not.
So tell us that, Aeryka, what is the fourth trimester?
Everything that happens when you go home with a baby, when you go home with this baby, so even in like with my doula clients, I would teach them, I would do breastfeeding and infant care. So infant care is not even just changing a diaper, getting a baby dressed, that kind of thing. It's teaching them that soothing your baby is not a 5-minute thing.
Mm-hmm.
It takes time for these babies to get used to whatever motion it is that you're doing to soothe them, to put them to sleep or whatever. Because consider it like this: they're in a warm space, they're in a dark space, they're in a consistently wet space all the time, while they're in the womb. But then once they get here, you're used to the sound of the washer and dryer. They're not.
Mm-hmm.
You're used to the sound of the TV and the refrigerator. They're not. How are you going to handle a crying baby who's afraid of the environment that they're in until you make them comfortable?
Yeah.
But that also means that you have to be comfortable with holding your baby, with swaddling your baby, with changing your baby, with even doing a sponge bath or giving your baby a bath.
Mm-hmm.
So who's going to wash these dishes? Who's going to wash these bottles?
Mm-hmm.
Who's going to wash and dry and fold these clothes? Who's going to bring meals? I encourage people to write down your trigger word or trigger phrase. I had a client who hated coleslaw, and she would text me, "I'm craving coleslaw," if she needed a postpartum visit. You have to. Postpartum planning is building your village, putting your village together, and saying, "Hey, you cook very well. Can you cook on Monday, Wednesday, Friday, Tuesday, Thursday, Saturday? I need somebody who's gonna follow this laundry." But also, I think with postpartum support is also kind of helping somebody, get back to their sense of normalcy, because it's less about creating a rhythm for them, but letting them find it and helping them navigate it.
And one of my big ones too is also making sure postpartum is another relationship. So once again, it just as Aeryka said, postpartum is a period. So postpartum is really just describing the time frame in which these things are happening. But just like how when you get married, you're two individuals who are not together. When you're in a relationship, you're two individuals who are not together. Because you have now had a baby or went through the birthing experience, and maybe you did not come home with a baby, that does not mean you're no longer you. And for so many individuals that I see, it comes down to, I'm not sure who I am outside of a mom, or I'm not sure
I hear
who I
people
am
say that
outside of a
often. They
wife.
don't know who they are anymore.
So a lot of that postpartum journey too is discovering, who is this beautiful person that is you?
and
because
rediscovering, you know, it's a new me. I'm still
it's,
me.
yeah, but it's a
I,
new you.
yeah,
Yeah.
it's a new idea. I have a child and I have to rediscover what it's like creating a new normal when you get to that space. Callie, what would you say your experience was like with that when you came home with your first baby? Did you get to a place where you felt like you needed to rediscover who you were or your identity?
Um, yeah, I would say yes. I feel like everybody goes through that.
Mhm.
Um, you know, I had a second baby 15 months later. So I feel like I'm still discovering that. I had two babies back to back, quit my job. You go through a lot of changes when you have a baby, that don't get like the fourth trimester just does not get the respect that it deserves. Like it is real. And the fourth, like technically I'm still in it. My daughter just turned 3 months. You know, people just don't, even with the mother themselves, people don't realize after you have the baby, your stomach is not going to go back flat where it was before. You're still going to come home looking pregnant. People don't realize stuff like that. Your hormones are going to be up and down all over the place.
Yep.
Breastfeeding is hard. People don't realize things like that everybody, we're all talking about it. The support is necessary. But yeah, I think everybody goes through a point where they feel like they need to get back to, maybe not get back to themselves. Like I didn't feel like I need to get back to me, but just like you said, find out who I am now as a mother, what can I do for myself outside of that? And self-care is definitely important. That's another piece that you have to try to figure out how you're going to work in there, because taking care of a newborn is 24 hours, 7 days a week.
Very taxing. And it's so what you said about breastfeeding. I went through a lot of this experience with my best friend. And, people talk about, oh, I'm going to breastfeed. Like the baby's just going to come out, latch on your nipple, drink perfectly, go to sleep. Like it's going to be this super easy process. And I'm sure some people may have that, but she had to, I would say she didn't last. Maybe it was 2 months. She tried to do it, but just wasn't producing enough milk. And it was just other factors. And just around the clock, how you got to pump, you have to massage the breast. You got to make sure, you're washing the bottles. There's so many parts that go to it because TV will have you glamorizing it, thinking that, it's real simple. The baby come, drink, you lay them down, and we all live happily ever after. And it doesn't go that way. So it's just one element of recognizing that there's so many working parts. And I wanted to ask this, why do you all think there is shame attached to people and if they do experience postpartum depression, where people just don't want to talk about it outside of, of course, some people don't want to tell their doctor because they may be afraid of the consequence of that. But yeah, right now I feel like there's still a lot of shame around postpartum depression. Why do you guys think that is?
I think because most people expect you just had a baby. They think that you're going to be happy and you're going to be excited. And you have to realize that you can be excited and happy. And, this is the best thing that's ever happened to me. But I also have to recognize that I may not be feeling 100%. And it's okay. It's okay to feel sad for yourself or just sad in general, but you can still be 100% there for your child.
Right.
But people don't realize that it's two different things. Like for me, I would say my experience, I was, excited, happy that I became a mother, but I also had moments where it's like, this is a lot.
Yeah.
It's still a lot, 18 months and a 3-month-old is a lot going on. And, they're running around screaming right now. It's a lot going on in the background, and people don't realize that it can be two separate things. It's not all in one, just because I have, postpartum depression I feel that doesn't necessarily mean that I'm not happy to be a mother, or I'm not happy to have my child, or I can't show up for my child the way that, I want to.
Right. Absolutely.
I think Callie made a great point of two things can be true. And the shame also comes from the fact that we as a society, and we're talking a lot about the African American culture and being Black women, we as Black women have to create space where individuals know it is okay to feel how you're feeling. Like that, it's not like you automatically should be bonded. Now that you're mother, you mothering should just kick in. It's an instinct. That's not it. And that's what I hear from a lot of individuals around the shame and the guilt that comes with it. that, and for those who are in the profession too, this understanding and gaining a deeper knowledge and always being curious and learning, because understanding the difference between postpartum depression and postpartum psychosis. Just because someone has depression does not mean they're having thoughts of harming themselves or their baby. Just because someone has depression doesn't mean that they want to die. Like, we have to be willing to ask questions, one, to know the answer, and to be able to create those spaces where individuals feel comfortable, just as Aeryka's client, and as Callie stated, even her being able to recognize I can still show up and have these feelings. For individuals to be able to do that, and with a lot of support groups and just even talking to clients, the very first thing I will say is, this is a space where we're going to say it how it is. If you ain't feeling like, today's a hard day, there's a lot going on, and you're like, I ain't even want to get out of bed. Okay, it's okay to say that. These kids getting on my nerves. It's okay to say that right here too, because we understand that
Right.
because you've had a baby doesn't mean you're no longer human, and you had a
Right.
life before that. You may even be grieving. And it's okay to do that because things have changed. It doesn't make you a bad person. These are seasons, and seasons change.
Right.
So I think that that's what comes with the shame. We say that because some of us have been through it. We're in those spaces, and we often have conversations among our friends about that, but not everybody has a circle like that.
Right. But they can have those kinds of conversations. Yeah, I just want people definitely to know that, for them to get the help that they need. And I think it's really important that we continue to have those conversations. So this leads me right to something you mentioned earlier, Chemyeeka, and I thought it was a great segue. I wanted to say, based on all the things we've been talking about that are reasons why we have this crisis around Black maternal health in America, do you all think that people need to sit down and start to do more planning and research before getting pregnant to come up with a game plan on how to handle the risk that comes with it? I know it may not be that simple, but do you all think that is a resolve of more? I guess it comes down to more planned pregnancies.
I wish I could do like a TikTok video or a reel to that statement, because you'll see me do the thing where I drop it low.
Yeah. Partition videos and
Yeah.
Instagram. So you would say
Yes.
yes. Your answer is yes to that. What do you all think? Yes.
I think definitely. And I also think that people need to realize that with planning, everything can go opposite of your plan. But when you do your planning, you're learning about all the things that can go wrong or can go not according to plan. So you're learning about all of those so that you're able to, yes, say, this is what I want, and this is what I desire to have for my birth or for my postpartum period, but this may not happen. And I understand that that might not happen. And I know that if X, Y, and Z happens, I know how to navigate it. I know how to pivot what I was, what my original plan was.
That helps a lot. Yeah, because even in the plan, like I really like that. Anytime you make a plan, you have the option they can go another way. But even if everything goes right, great, I learned a lot. But even if it goes another direction, I still learned a lot. I know what to do. I know how to navigate this. It'll prepare me for, down the road if I have more children or educating people around me. And, those are the kind of trends that we want to set, to put out there. So do you all think that we can really get people on board to do something like that, to have that kind of mindset shift? Like, is that really an option, or are we just kind of talking to ourselves?
Oh, no, it's an option. That's why on every platform, this is what your girl be preaching.
Okay.
I think it can happen where, everybody gets on board. And even going back to, it's taking a village to raise a child. You have to include your village in these plans too. Especially working as, doulas, you run into situations where, families aren't receptive of having a doula in the space.
Wow.
Especially now in COVID time. So, I think it is definitely possible to sit down with everybody involved who's going to be involved in the rearing of this child and be like, okay, this is what we doing.
This is the game plan.
This is how we doing. This is the game plan. This is what we want, but we always going to be ready for the pivot.
Yep, always. So educate the listeners, what's the difference in a doula and a midwife? Y'all look, whoever wants to jump in.
I mean, you got an OB on the line.
So Aeryka, what is the difference in a doula and a midwife?
In short, your doula is focused on literally the comfort and the mothering of the mother.
Okay.
Or the birthing person. Your midwife is less concerned about your comfort, more concerned about the safety of the birthing person and the baby.
Are midwives still like common? Are they used often? Are they still?
Yes.
Oh,
That's why home births are happening.
Because I'm a doula, I feel like they are, but yeah, like even some
Yeah.
people are going into hospitals and asking,
Yeah.
"Hey, is there going to be a midwife on staff when I give, give birth?"
look,
Yeah.
that's why I'm asking. I don't know. I'm
Yeah.
thinking of old and Victorian times. And I think like, that's still a real thing. Okay, so,
Yeah. So there's your traditional granny midwifery where people who are born at home with the village around, and then there's CNMs, CPMs, there's the nurse midwives, and then the direct entry professional midwives.
okay, so different levels to it. Gotcha. So the myth out there, or the idea, is that doulas are super duper expensive and they are not affordable. Would you all say, I know they may not be affordable to everybody, but are doulas something affordable that people could have access to?
Yes,
Yeah.
there are different levels to this game.
Okay. So like a midwife is different levels. So I just want the listeners to know, like, doula, I think we used to hear you think you got to be rich to have a doula. And it's like, you don't.
And so many people are being trained to be a doula right now that
Yeah.
if you are willing to have someone walk alongside you as they're getting certified, that is one way to cut the expense. Change up what your baby shower offerings look like. Tell people you want money for these doulas. And then also, even as we talked about, when you're looking at putting together your care team, what are the aspects where you're spending extra money where actually if you put the money into a doula, you wouldn't even have to pay for that expense?
Stop doing these gender reveals.
There's actually an app. I'm gonna see if I can find it before you put the episode out. But there's an app where it's a gender reveal game, but what people do is they bet on the gender. So they pay like $1 or however much they want to towards that gender, but all that money from the game goes towards the doula expenses.
Oh, okay, that's cool. I like that idea. And nothing against, I'm joking, nothing against gender reveals, but I think if you got to choose where to spend your money,
I mean, doulas offer payment plans and that kind of thing. Like on my website, like people can go and purchase a gift card towards somebody's services and apply it that way. So there's a way to get it done.
There's a way to get it done.
And up north, there's policies and legislation going into place for insurance to actually reimburse. We ain't got like you down here. And I'm originally from Georgia, so shout out to GA because they up in their game. Tennessee,
right?
We pushing behind. But there's movements happening for doulas to be covered by insurance, so that once again, when we talk about access, you're getting that care as a part of what the healthcare system has deemed necessary.
Okay. So let's go to Callie. I want to lean to you a little bit about the staying in shape while pregnant. I want to bust that myth that, the joys of probably eating macaroni and cheese for breakfast, occasionally.
Oh, man.
But, people tend to think that I get pregnant, this is 9 months where I'm not going to be doing much. I tend to see on social media, like if you see somebody that's pregnant, that's working out, you look in the comments, everybody like, oh, you don't need to be doing that, or you have people that it's amazing to me when I do see people that say like, they were able to like work out their whole pregnancy. Of course not, they're not out there doing CrossFit or nothing, but
there are those that do.
Well,
I don't speak that though.
Lord. Well, just speak to the people about like the importance of like staying in shape and not just sitting on your butt for 9 months when you get pregnant. That's not what you're supposed to do.
Oh man. So it's very important. I can say that in my experience, the difference between my two pregnancies, for my first one, I thought, I had a great pregnancy the first time around, but with the bleeding, what happened was I went to the gym and then I had bleeding that night. So I went to the hospital. And once they told me that, I stopped working out. I didn't really work out too much during my first pregnancy, maybe a little bit here and there. But I had issues, it was a great pregnancy overall, but I did have high blood pressure. I did have, my feet were swelling all the time and I was tired and I couldn't move. And I try to generally eat right, what I feel like is healthy, but, I did eat a little bit more during my first pregnancy. My second pregnancy, however, when I worked out throughout the entire pregnancy, I didn't have the blood pressure issues that I was having. I didn't have, my feet weren't swelling up every night and my hands weren't swelling up. And I just didn't have any of those same issues, which is very important for, this overall topic that we're talking about. You kind of just got to think about, in general, when you don't work out, how do you feel versus when you do? It's the same during pregnancy.
Yeah.
And also another huge piece of that is how we eat as well. We are not eating foods that promote life. And this is very important because it leads to all of the complications for the mother, but it can also lead to complications for your baby. It can lead to all of these genetic abnormalities. So working out it gets the blood flowing. You get more oxygen to the placenta, which means more oxygen is going to the baby. The baby, it helps with gestational diabetes. It helps with high blood. It just helps with overall everything. Working out, it helps with your mental health. Even if you just take a walk,
It definitely makes a difference. And I
Be
love
out there, do something.
Did you say, so do you have like a program you said earlier related to that?
Yeah, so I do pre and postnatal fitness coaching. So you can come to, you can see my Instagram or my website, and on there I show workouts that I'm doing myself that are pregnancy, postpartum specific. So right after you have a baby, you can't go back to straight what you were doing before. Like, for example, CrossFit. People are doing CrossFit before, you can't go straight back to that. Even if you worked out throughout your entire pregnancy, even like for myself now, what I was able to do during my pregnancy, I'm not doing that now. I'm still in the process of building back up to where I was, because it takes time. It doesn't take 6 weeks, it doesn't take 8 weeks, and it looks different for everybody, but it does take time to be able to build your body back up. You have to lay that foundation to be able to get back to where you were. Or even some people are able to even surpass where they were.
Yeah, once they get back to it. But I love that the attention that you're bringing to it, and that you have a program. And of course, we'll be able to share that information with the listeners when I release the episode. So, Aeryka, I saw you make a face when we talked about what we're eating. What are you seeing? What are we out here in these streets eating? What are we doing wrong? I can't be eating, so I can't eat Wendy's 4 for 4.
So here's my thing with patients and clients. Eat well as best you can.
Right.
And when you cannot, eat what you're gonna eat guilt-free.
Yeah.
And try again tomorrow.
Exactly.
Try again tomorrow. That's all I can tell you. It's just, but if you, especially going into it, if you have chronic hypertension, or genetic history, or predisposure to like diabetes or whatever, you're not helping your situation.
Yeah.
You continue your normal habits.
Right.
Even with the exercise, like it, our grandmothers and great grandmothers say, "Oh, you sit down, don't do too much, don't move." No. Not even just that, and fighting off swelling and blood pressure and that kind of thing. But this is just naturally gonna make the labor and birth experience a little bit easier for you.
Yeah, makes sense.
When you get your body used to expanding and stretching to accommodate this growing baby, it makes it a little bit easier.
And even the birthing process, there are different poses and things that you can do that mimic how this is maybe going on to another topic as well, but laying down in birth, that you're going against gravity, basically. So if you prepare your body and do certain stretching or certain exercise moves, and you're used to being able to hold your own body weight, standing up, squatting while you're in labor, sitting on an exercise ball, things like that, lunging, all these things, standing upright, help you with the pain while you're in labor. And these are all things that you can be doing prior. And then even postpartum, like car seats are heavy. you got to be able to carry a car seat with a baby, a diaper bag, a purse, whatever you need, and get into the car, get around to wherever you're trying to go. So working out just helps you get a little bit stronger. So, things that I suggest would be like, instead of some people, some people just don't like working out. Instead of working out, and holding weights, if that's just not your thing, start by swinging your car seat. It's just as heavy. You get used to holding the car seat. And then once you have your baby, you can put the baby in there, and you get used to the weight of that. Sorry, I lost my train of thought.
Fine. Excuse me, you've given great suggestions that I definitely know, like, people don't think about. Yeah, carrying a car seat, carrying a diaper bag, carrying everything, all that stuff. You like a bodybuilder with all the stuff you have to carry around. We have to think about that. So I want to say, this leads me to think about geriatric pregnancy. So does that start at 35, Aeryka? Or what age would that be? Would you be considered geriatric?
So you want my response?
I want I want both. I want the doctor, and I want your response. I want both sides.
So 35 is what would be considered advanced maternal age.
Okay.
You're not geriatric.
Okay.
But I've also seen, a 47-year-old first time parent. I've seen a 53-year-old second time parent and had an eventful pregnancy, labor, birth. A lot of what you do prior to pregnancy, during pregnancy, after, can help. The only thing you know to do is, your best, whatever that looks like. But I don't think there's necessarily a cutoff per se. There's a lot of science and a lot of faith out here that can get the job done. So, medically, people would say 35 plus, that's your cutoff time. But even without, all the science involved, people are still able to, conceive naturally and be fine.
Also, I know for so many people, prenatal vitamins are what you take in your first trimester or perinatal. But I do want to remind you, they say prenatal, which means before. So you can take your prenatal vitamins before pregnancy, and make sure you are getting in that folic acid. Like, all these things are important. They're important in the first trimester, which means, as Aeryka's talking about, what you do to prepare your body before pregnancy can help. These are things you can be taking once you know that that is the journey you want to be on. Or for women, just because we need them. Our body needs those vitamins.
Mm-hmm. Absolutely. And that makes me feel a lot better, because one of my friends like to joke with me, like, yeah, you geriatric, so you're trying this. I'm like, child, if Janet and Hallie can do it, so can I. I don't know what kind of magical pills they might be taking over there. But what would you all say? How do women of color protect themselves and their child? This goes right into perfect segue, from the moment they find out they are pregnant, in regards to like prevention, preventing mortality or complications related to maternity. Explain what that process should look like for somebody who's never had a child. Like, the moment I find out I'm pregnant, what should my journey start to look like? I know I need to take my vitamins, my folic acid.
You got to drop the bad habits. So I'm sorry for all those who may be like, oh, I got a little window. The first trimester is critical. Stop the alcohol, stop the smoking, stop being around the smoking. So don't go to the hookah bar. Like, your environment is critical. Like, change that up. These foods we talking about, like, oh, it's okay to, try again tomorrow. Yes, but no. Like, if you just found out and you weren't planning to get pregnant, and your lifestyle was not showing someone of like, oh, okay, if I get pregnant anytime, I'm okay. Because so many of us think I'm coming off birth control because I'm of the age where if I get pregnant, I'm okay, and don't realize, like, no, your lifestyle needs to say that as well. So there are certain foods, fish, consuming certain raw things, even certain medicines. Like, the minute you find out you're pregnant, you also need to be asking your doctor about those medications you're on, because some of those things cause birth defects. So, not to scare anyone, but just to say, if you find out you are pregnant and you were not planning to be pregnant, in terms of like dropping everything that could like be an issue, I need you to, speak to your physician and find out what you are doing right now that could possibly, be a disadvantage to you later on down the line.
I love all those suggestions. What would you say, Aeryka?
Everything Chemyeeka said. And hire a doula. Hire a doula. Also, if you're wanting to go the home birth route, secure your midwife. If you're wanting to do, birthing center, make sure you get all that cleared and together. And going back to what you said of, changing your lifestyle, also consider what's happening, prior to prenatal. There are patients and clients who may have like one kidney. You have to adjust your care. If there's a previous surgery, it's like having had gastric sleeve or that kind of thing. There's a lot that you gotta consider.
And I didn't think about that, like different things, like a kidney, or I've had a surgery before, or even the fact of, because I really did have that mindset of, say if I unexpectedly found out I was pregnant, like I got a little time, like the baby just got in there, like I can still hit this hookah or something.
Right, that's the critical period.
Critical period.
That's it. That you gotta prepare.
In this case, ignorance is not bliss. Like, I don't understand how much I have sat here and learned.
Because if you would have texted me, I'd have been like, "Hey, so what I'm gonna need you to do right now."
You gotta be ready.
I know I gotta do my best to plan the way my life's set up. I'll be in these streets. I gotta try to plan. But
self-care, all of that.
What would you suggest, Callie, in regards to like the moment you find out you're pregnant? What's something else that we should be doing on top of what
so I definitely would agree with the, changing your lifestyle up. I think the biggest piece for me would be to educate yourself. If you educate yourself, then you're able to change your lifestyle. You're able to do the things that you need to do. You're able to speak up for yourself and advocate for yourself in order to have a safer birth. Education is everything. When you know better, you do better, basically.
Yes,
absolutely, because that speaks to something else. I'm just going to refer back to a best friend in talking to her. She, with the experience she had with breastfeeding her son, because she was in the throes of it, I was reading a lot of information. And so you get on Pinterest, you read one article that says you need to start as soon as you had a baby at the hospital. Then you got another article to say, no, wait till you get home. Then you got another article to say you need to cluster feed. It was all this information that was out there. And it's like, it's not one size fits all. Like you have to figure out and test it out and try what works for you. So that definitely correlates to the education piece, that from what's really happening to your body when you have the child to giving birth, what is that process? Because I remember in biology in college, my biology teacher always said, and I didn't grasp it right then, but she would always say, having a healthy baby is a miracle. And I want y'all to know that, like, don't take that for granted. And it always stood with me because I was very blessed that growing up, everybody around me just, got pregnant, had their baby, didn't really experience a lot of loss. And then as I got older and I started to experience it with family and friends, it just was like, why is this happening? But then you understand, like, if you really know the science and the education, all the things that go into making a baby, making sure it gets here safely, it's not as easy as flipping a switch, like the snap of a finger. So I think everything that you guys said is so essential and so important. And I think that goes back to something we mentioned earlier. If we can plan when possible, but when we don't plan and we find out, to start taking these necessary steps and reach out to the village and reach out to your community and use all your resources, because our goal is ultimately to get those mortality rates down. We need our Black women. We need all of our sisters here. So much was unpacked in this episode. I already know we're going to have to revisit it at one point, but I want y'all to just give yourselves a round of applause for an amazing episode. When I tell you all, this was season 4, this is probably the one episode I've learned the most. When I tell you, not so many things y'all have said, I'm just like, what? Like, so I'm a researcher, so I already know now. I'm about to be on my phone looking up. So medical kidnapping, what she said it was. So like, I'll be looking up everything. But I definitely want to be sure, yeah, we get this out to the masses so they can just learn as much as I did. Because I know with me being a person that likes to stay educated on things, if I learn this much, I already know the listeners are going to learn a ton. So if they start blowing y'all inboxes up, asking questions, y'all already know why. But word of the day, I would say doula. Y'all get a doula. It's affordable. Y'all can do it. And before we wrap, though, I just want to ask, did you all see, this was on Instagram, the young lady who put out that she had hired a doula and she spent, was it like around $6,000 or something?
Yes.
And I didn't dive too deep into it, but I was like, I mean, if she got the money, she explained what she did and why she did it. It made sense to me, but it was just a lot of people that were really upset. Y'all saw that? What did y'all think about that? Like, was that like normal? Like what?
I mean, I gotta say, because once again, I am a doula. I'm also, an advocate. And then because I am somebody who's like, do what you gotta do to care for your mental health, I saw nothing wrong with it. If you have the means to pay somebody they worth, listen, y'all, we as Black people are advocating for our worth. So even if another Black person gonna pay me my worth, I ain't counting nobody else's pockets
At all.
I'm cheering you on, because that's giving me a clue. Okay, maybe down the line I'm gonna find somebody that can pay my full worth.
Yeah.
Pay for all this knowledge and education I done got. But yeah, she was getting a service and being taken care of. And it kills me when we have something to say about it. Like, was you gonna go take care of her? Were you gonna go help take care of the baby at night? Was you gonna fix them bottles?
I was like, show me the problem. Like, I don't see a problem here.
I've seen so many Black women now talking about, like, we need to be okay with Black women living in luxury, and then saying how they're living in luxury. I worked hard to get where I am, and I should be able to talk about it and not feel like I don't have, like, if I have a crowd to share my struggles with, I want a crowd to be able to share my joy with too.
Exactly. That's why I don't get on the internet saying everything, because I don't be having time to argue with people, because people will want to argue with you about your life and what you're doing.
I also think that because a lot of doulas do this because it's passion for them, so people think that you should just be doing it because you love to do it, and not realizing that yes, but I still got bills. I should be paid, like you said. I should be paid for the education that I got in order to help you. I should be paid for the service that I'm providing to you. So that I didn't see anything wrong with it either.
Not at all. Did you see it, Aeryka?
Because somewhere somebody made doula synonymous with volunteer. And
next to each other in my dictionary.
Right. I don't know how people really think that.
If you had to really sit down and calculate like a living wage, the number of hours that you spend with families, both prenatal, during labor, birth, postpartum, the price that people are charging is reasonable.
Yeah.
Can we talk about the wear and tear on the body? Like, especially I did my first home birth, and I did not realize the ways you maneuver yourself on the bed and in other places. Like, I need a chiropractor. Like, I'm advocating for you to go get your body checked on, and I gotta go get mine checked on too, because I ain't young either.
Y'all definitely need to be paid, because I just know in situations when people told me about having a doula, like, yeah, I called my doula for this, my doula, they saying all the stuff they do with their doula. I'm like, that must have cost a lot of money. Yeah. And then just the mental health pieces, which I have to deal with, talking to, going, pay these doulas.
It's a constant energy exchange.
Yes.
Energy exchange.
Yes.
And then think about it too, like, especially if you having a baby over the holiday, we're telling you, make sure your doctor doesn't schedule a C-section just so you have that baby on their clock. But that means I'm also going on call and I'm not going places. And for those of us who do more than just doula care, those are other jobs I'm taking off from, or events and social life I'm putting on hold to help you bring your baby into the world. And once again, that's not saying that in a bad way. That's just saying, because I care so much about my job, I am rearranging my schedule. But also, that's not like I'm becoming part of your family, but that's still a service I should be paid for, because I am putting my life on hold to an extent.
Absolutely. That was an episode of Grey's Anatomy. This doctor had all these mortality rates because she was scheduling C-sections because she didn't want to do them on a weekend.
Some truth in everything.
Yeah, you know me. I had to go look that up. That was real. So yes, on that note, again, we are wrapping up. I want to thank these wonderful ladies for coming on to the show today. You guys have been amazing. And we're just going to do a quick roundtable so everybody can tell the people where to find you. And since I was last with your introduction, Chemyeeka, I'll start first. Tell the people where they can find you.
Hey, everybody. I am still on these internet streets at Positively Meek, POSITIVELYMYEEK. That is on IG and Twitter. I got a Facebook too. I don't really be on there, but y'all can check that out on Facebook too. And then also the website is getting ready to launch. So www.positivelymeek.com. It's rebranding, so you might see some of my old work. If it's still up when you go look, feel free to check out the poetry, all that other stuff. Your girl got multiple size tools, so just know, I do that.
Love
But
it.
yeah, so Positively Meek anywhere, and feel free to hit my DMs. I'm always like, if you got a question, I'm gonna respond or send you a resource. I now have an amazing Atlanta doula by the name of Aeryka. Somebody like, oh, they need a doctor or something, for those of you in Nashville who maybe think about moving, all my Atlanta fam, please know, yes, I am adding her to my resource list. So
Yes.
yeah, make sure you listen when she call her info though, so I don't have to keep repeating myself.
Love to see it. Website coming soon. Can't wait. And so, Aeryka, we're gonna go to you. Tell the people where they can find you.
So I am across Instagram, Facebook, Twitter at T3 Doula Services. That's T, the number 3, and Doula Services. From there, you can pretty much find everything else. My nonprofit, T3 Helps Inc., where we raise money to be able to pay for doula services for, those low income birthing persons. We also have a doula directory. So if there are any doulas listening, please feel free to join our doula directory. We do not want to keep our love in just Georgia. Yeah, I'm pretty much there. Listen, I'm gonna tell you just like it is. I do not do this beat around the bush, social media thing. I'm this way in real life. Probably more mild on social media actually, but please go and find me at T3 Doula Services, and from there you'll find anything else linked to me.
Y'all gonna find her. She is awesome. I emailed her. She responded quick. I was like, yes, she is in there. I love it. Efficient. I love it.
Yes.
And Callie, last but not least, tell the people where they can find you.
So I am on Instagram and Twitter at The Kinetic Nurse. So TheKineticNurse. And then my website is www.kineticmoms.com.
I love it.
And, you can also find, everything else from my social media as well.
On the socials, y'all better go find these women. Y'all.
I forgot to say, it's some other stuff attached to me, but it's attached to my social media.
Okay. You sure you don't want to say it?
Oh, well, yeah. So doula services, I'm contracted with Birth Manifesto. You can either have me as your doula or your postpartum therapist. And also therapy services with Hampton House Counseling is where I'm contracted currently. So yes, there's access to larger groups attached to me when you reach out to me. And like I said, if you hit the DM, I will respond immediately.
Awesome sauce. So again, thank you, ladies. I cannot say it enough. This has been an awesome conversation. I know it's going to be a continued conversation that we'll come back to. I love it when we have conversations that carry throughout the season or carry over to the next season. Thank you all for listening, and I'll be right back with the Montana Minute. And now this brings us to the Montana Minute. The first thing, listen to these 2 episodes again and take notes if you need to, because so many great gems were absolutely dropped. The next thing, the philosophy of don't fix what's not broken is canceled immediately in regards to this, because even though we have been having some babies successfully, the way we have been going about doing it has been broken, and we have to fix that now. And the last thing, having a baby is an absolutely beautiful thing. And the way that we get out of this epidemic that is over Black maternal health so we can have more mamas having beautiful babies starts with me and you. We have to start moving different. We have to start thinking different, and we have to start working together differently. So I hope that you guys enjoyed this episode and meet me back here for part 3 of this series for more heat. Now, signing off, yours truly, Shanna Montana.